Welcome back to Ronnie, I'm Joe B. Have you ever wondered what are the best exercises to improve stair climbing after knee replacement? If so, then let's dive in. After a total knee replacement, most of the time, the patient will have difficulty ascending steps due to quadriceps weakness and descending steps due to a limited knee flexion motion. In order to improve stair climbing, we need to understand the different phases of stair negotiation so we can strengthen the appropriate muscles needed for each phase. The stair negotiation has 5 phases. The first phase is called weight acceptance. In this phase, there is a gluteus maximus eccentric contraction, quadriceps eccentric contraction, and tibialis anterior concentric contraction. To improve this, you can do step taps where the patient stands in front of the step and taps the first staircase with the foot on the operated side. This can be performed for 10 reps, then switch sides. The second phase is called the pull-up phase. In this, there is a gluteus maximus concentric contraction, quadriceps concentric contraction, and gastrocnemius concentric contraction. To improve this, you can do a step up where you ascend the first staircase leading with the operative leg, but come back down with the non-operated leg. This can also be performed for 10 reps, then switch sides. The third phase is called a forward continuance. In this phase, there is a gluteus maximus concentric contraction, quadriceps concentric contraction, and gastrocnemius eccentric contraction. To improve this, you can perform a tap-down exercise where the operated leg is on the first step while the non-operated leg is lowered slowly to the floor. As soon as the heel hits the floor, you should go back up, and this exercise can be performed for 10 reps, then switch sides. You can use the railings for balance and support. The fourth phase is called a foot clearance. In this phase, there is an iliopsoas, hamstrings, and tibialis anterior concentric contraction, while the gluteus medius on the opposite side does an eccentric contraction. To improve this, you can perform a standing rainbow, where the patient stands on the non-operative leg to contract the gluteus medius, while the operative leg follows an arc or rainbow pattern movement with knee partially bent and toes up. This can be performed for 10 reps, then switch sides. The fifth phase is called a foot placement. In this phase, there is an iliopsoas and hamstrings concentric contraction, as well as a tibialis anterior isometric contraction. On the opposite side, there is a gluteus medius concentric contraction. To improve this, you can perform the step taps and single limb Romanian deadlifts or RDLs, where the patient stands on the non-operative leg while the operative leg kicks back with the knee partially bent and toes up on that side. The patient can hold onto a stable object for this to prevent loss of balance, and this exercise can be performed for 10 reps, then switch sides. So do you want to know how to improve a sleeping quadriceps muscle after knee replacement for ease of lifting your leg to and from the bed, as well as to and from the car? If so, then this video is for you. Thank you so much.